Hey everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about claim denials and the administrative burden that goes with them. I cannot tell you how frustrating it is for all of the claim denials that come through anymore. When I say claim denials, I don't necessarily mean the entire claim is denied, which yes, that happens. But we're seeing more and more of line items on the claim being denied. So if there's 4 CPT codes, 3 get covered and 1 doesn't, or 2 and 2, or 1 and 3. And that is so frustrating because you want, and it's good business sense, to capture as much revenue as possible. So you can't just turn an eye and say, oh, it's fine, we got paid a good amount for this claim in general, I'm not going to worry about that one CPT code that would only pay us $4 or $5. And I understand what you're saying to a certain degree, but that's a very narrowed approach. You're not thinking about it globally on a higher scale. That reimbursement for that one code might only be $4, but 100 of those are $400. 1,000 of those are $4,000, and it adds up is my point. And so leaving money on the table, in my opinion, is unacceptable in most situations. The problem right now is that insurance companies are seeming to change their policies and payer guidelines very rapidly. And it feels as if they're finding a lot more reasons to deny certain codes. And that is requiring billing staff to go away from their normal workflows and adapt a new workflow of trying to track down and figure out exactly why a code was denied. Because even though the CAS code and the remark code, if there is one, on there is supposed to give the explanation, it doesn't sometimes or oftentimes make much sense. And then you're having to go, okay, well, I've never seen this before. They used to pay it, or the other insurances pay it. What's going on here? So then you're having to research policy and payer guidelines. You probably have to call the insurance to find out more information. Most likely you're going to have to submit a corrected claim, or you're going to have to send supporting documentation. I feel like so many more are requiring documentation to support the billing, which takes more administrative time. And it's just getting very overwhelming for not only your revenue cycle staff, but also your management and the people who are waiting for the money, like the doctors and the owners, and they're wanting to know why there's a delay in money coming in, or why all of a sudden there's a deficit, and they start thinking that something's wrong with your staff not doing things correctly, and it just kind of snowballs and it can get really ugly. And the reality of it, honestly, in my opinion, is that the insurances are doing this on purpose because they are feeling the squeeze of the financial situation that we're all feeling for different reasons, and they are making it very difficult. Now, I think hospitals even have it worse than us clinics with the professional claims. I think the UB claims and the hospitals are seeing this even more right now, but it is something that's being felt industry-wide. You're not alone if your staff or if you are feeling this. And it's definitely hard, especially when you're taking your staff out of being productive of submitting claims or fixing easy claims to be resubmitted and paid. You're having to take more time, administrative burden type situation, and looking things up, making phone calls, waiting on hold, finally talking to someone. Who knows if that person can really help? Sometimes they're very helpful, sometimes they're not, so you have to call back. Sometimes you can't get a hold of anybody, you have to leave a message, or you can't call, so you're relying on an email type situation, which is even more frustrating. And then you get the information and they tell you, well, you have to do it through this portal, or you have to fax it to this number, or no, we don't have a claim on file. And you're like, what? I mean, there's just so many things that are going into this right now. And it's always been a situation like this. isn't brand new. It just seems like it's getting more frequent is what I should say. And so if you're feeling this in your practice, or you're starting a practice and you're not aware about this, please know that this is a factor. It is not an excuse for a billing company or a billing specialist to be dragging their feet and not getting claims out the door or working your AR, but it is a reality and something to consider when you're looking at their productivity or you're looking at your finances. It is a factor no matter what. Again, it can't be used as an excuse. I don't believe in that, but it is something that does need to be made aware of if you need to put extra resources temporarily in certain situations to be able to work things until they get adapted to, or you learn the new requirements from an insurance so you can put upstream kind of workflows in place so it doesn't affect billing and the RCM so much. That's great, but there should be some kind of solution put into place, and it should be temporary. Once it's identified, a solution put into place, and then moving on. It shouldn't be something that's ongoing, and like I said, it shouldn't be a long-term excuse of why things are delayed or not getting worked. If you're experiencing this in your practice, I would love to hear from you, so please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with all of your colleagues in healthcare. Get the word out. If this is happening to them, I don't want them to feel like they're the Lone Ranger and they're doing something wrong. I mean, there could be something going on that's being done incorrectly by the staff, but it's also, there are a lot of things going on with insurances too. So anything you can do to send out clean claims so that things can be as less likely to deny as possible is always good. So thank you so much for the support. We'll see you next time. Bye-bye.